undertaking that Chairman Janikowski outlined in a speech he gave in America's Mobile Broadband Future, whether it's related to a spectrum policy or establishing a shot clock for tower siting as a way of, again, creating the right environment for private sector investment. The third area that I actually like to focus on today is what you might call innovation for what? That is, looking at innovation not only as an end in itself, as a powerful driver for economic growth and job creation, but really a powerful tool for addressing a broad range of the national challenges that we face. And so I was delighted to see that the Mobile Future Coalition has, as an element of its agenda, supporting advances in wireless technology to create new opportunities in education, medical care, and public safety. And interestingly enough, there's a lot that is going on in developing countries that I think the United States could learn from. And I'm just going to give a brief description of something that is occurring in India right now, where a leader from the social entrepreneurship organization called Ashoka is seeing what's happening in India. And he says, there I was looking over the shoulder of a woman physician in a unique 400-plus seat medical call center in India as she dealt with a female patient with abdominal pains. The patient was calling from her home on a mobile, had been initially engaged by a trained lay health worker, and then pass it on to the doctor. As the doctor asked questions guided by a software tool called a clinical decision support system and selected the patient's answers, the questions on the doctor's computer screen changed. Within a few minutes, the doctor had isolated the problem, decided that she didn't need to dispatch an ambulance, selected a medicine, clicked on another tab that sent an e-prescription by text message to a patient's phone. The patient can take that message to her mobile, to a pharmacy, fill her prescription. The whole process took 3 to 4 minutes for the patient. And it also didn't cost the government much because it only used a few minutes of the doctor's time, so that now she can deal with more than 100 patients in an 8-hour shift. So that's just one example of the way in which this technology is beginning to really have a transformative impact on the delivery of healthcare in India. So clearly, one really promising area that I think we should all be focusing on is the area of mobile health. And researchers at the West Wireless Health Institute based in San Diego have identified potential applications in Alzheimer's by measuring vital signs, location and activity, asthma, respiratory rate, diabetes, blood glucose and hemoglobin, hypertension, blood pressure, and sleep orders. So that's, I think, one really interesting application. A second, which has been highlighted by a NSF-funded center at UCLA called the Center for Embedded Network Sensing, is the notion of participatory sensing. That is, what happens as more and more people have a mobile device that has a GPS, a camera, and may have multiple sensors. And what happens when you have a public that can record, discover, and act on the patterns that are important in their life, whether it's grassroots sensing of pollution sources by community groups, or identifying and prioritizing areas and communities that need to be repaired. In the area of education, many school districts across the country are now providing real-time online access through mobile for parents so that they can access their children's grades, assignments, and attendance reports. Government, believe it or not, using a technology called augmented reality mashup, now available on the Android and the iPhone, you can now walk around the United States and find out what projects are being supported under the Recovery Act. In the area of mobile banking, one interesting question is, to what extent could mobile banking allow financial institutions to serve unbanked or the underbanked more profitably, who currently suffer from high fees for basic financial services, high-cost payday loans, and a difficult time saving up for assets such as housing. Here again, there's a lot of innovation that's occurring in developing countries that arguably outstrip some of what is happening in the United States. A product called M-Pesa, which started out in Kenya, allows users to deposit and withdraw money from a network of agents that includes airtime resellers, transfer money to users and non-users of the service, and pay bills. It started in March of 2007 and already has 7 million subscribers. So I think on the application side, it would be really interesting to have a conversation that involved both government, industry, the nonprofit sector, the research community, and ask a couple of questions. One is, what ambitious but realistic goals should we be setting as a nation for the use of mobile technology to address national priorities? What multi-sector collaborations could one imagine that would help advance these goals? What would be the appropriate division of labor between government, industry, academia, nonprofits, and grassroots users? So one could imagine addressing legal and regulatory barriers to the expanded adoption of these technologies, establishing prizes like the prize that Netflix did, or the Android Developer Challenge, exploring the role of government as a user, research, both for rigorous evaluation to determine the costs and benefits of these new applications and advancing the state of the art of what's happening, and creating fora for multi-sector collaborations, such as the Mobile Health Alliance, a collaboration between Vodafone, the UN Foundation, and Rockefeller, which is looking at the applications of mobile health in developing countries, but having some of these efforts that look not only at the global applications of these technologies, but the domestic benefits. So in summary, the administration is really committed to creating the right environment for private sector innovation and to working with the industry and other stakeholders to figure out how we maximize the role that these technologies can play in addressing the grand challenges of the 21st century. So thanks again for the opportunity to speak.
A small quick